Good afternoon, and thank you for joining us today for New Reach Pathways Home virtual discussion. Despite increases in the COVID positivity rate and hospitalizations, and despite the continuation of the eviction moratorium, monthly eviction cases are climbing and have already exceeded the total number of filings for 2020. Court records show that filings for lapsed time have increased by 85% in 2021. Compared to the same time period in 2019. In addition, the effects of the pandemic continued to disproportionately harm people of color. From January 1st to December 31st of 2020, landlords filed a total of 6,430 summary process cases. Through this year, through October 27th, landlords have filed 7,716. Connecticut courts already issued more executions in 2021 than all of 2020. And an execution is issued, a marshal can serve the tenant with a notice that they must move out in 24 hours. My name is Kellyanne Day, and I'm the CEO of New Reach. It is our vision that all children, families, and individuals have safe, secure, affordable home with the services necessary to not just survive, but to thrive. We do this regardless of age, gender, ethnicity, race, religion, and sexual orientation. Last year, New Reach provided crisis services and housing services to over 3,500 people throughout Greater New Haven, Bridgeport, and Danbury. In addition, we diverted over 1,200 children from shelter and housed close to 700 people safely and affordably. Today, I'd like to introduce you to the New Reach Stable Families Eviction Prevention Partnership Program, which has been operating for over 12 years. New Reach, Connecticut Legal Services, and Park City Communities partner to prevent families and individuals from being evicted. Today, you'll hear from Allison Feely, New Reach Program Manager, Shirley Bush, New Reach Case Manager who works directly with families and individuals, and our partner Madeline Anderson from Connecticut Legal Services. In addition, TJ Sioka who works to ensure that the program has funding. We'll talk to you at the end of the program about how we do that. This program is 100% funded through private dollars. Many thanks to all of you for attending, and thanks to our sponsor, Nutmeg Consulting, which is a high-quality IT and project management company who has an expertise in implementing and managing State of Connecticut's homeless management information system. Thank you, Nutmeg, for your support. I would also like to thank staff who are participating today for their time, their professionalism, dedication, and compassion. And finally, I'd like to recognize New Reach board members and former board members who are joining us today. Aisha Bello, Mary Ferrari, Al Smith, Linda Zimmerman, and our board chair, Leo Connors Jr. I'd now like to introduce Allison Feely, who's been working at New Reach for 5 years, actually this week. She's a licensed master of social worker. Allison?
Good afternoon, and thank you all for joining us today. As some quick housekeeping as we start the discussion, please keep yourselves on mute. But if you do have any questions as we're presenting, feel free to add those into the chat, and we will review all of those questions later on in the Q&A session. The Stable Families program of New Reach has been providing case management services to households at risk of eviction for more than 12 years to support housing stabilization and prevent homelessness. The program was started as an identified need for the greater community in response to the displacement of numerous families who had no place to call home when 2 large affordable housing complexes were demolished. A class action settlement initiated funding for this program, and we have maintained a 98% success rate of stabilizing households in their community since. In the past year, we've doubled the number of households served with the opportunity to expand our services from families with children to households without subsidized or income-based rent, as well as elderly and disabled individuals facing eviction in our community. Shirley Bush, who joined us just under 1 year ago as part of our expansion of services, will speak to the impact this work has had on the households more specifically later on in this session. Next slide. Case management and eviction prevention do not just focus on rent itself. Families entering our services come with experiences and histories far beyond the surface of the eviction. We offer support to people who have active domestic violence or community violence, have landlords that are unwilling to negotiate a continued stay in their apartments, have affordability and habitability issues, may be experiencing unemployment, underemployment, limited income, or no income at all, children who are experiencing difficulties in school, or maybe they themselves, as the heads of household, are recently learning how to manage their own anxiety and depression. Our services not only address the eviction itself, but we extend our support, hope, and opportunity to address all of the contributing factors or stressors that can create barriers to housing stability. Next slide. When considering the complexities and challenges our families face on a day-to-day basis, we break them down into 3 categories. First, we partner with them to address the crisis at hand and ensure immediate safety. Then we co-create goals to bring in or strengthen services and support needs. And last, we look to the future and what would create sustainable impacts with a goal of ensuring ongoing stability so they would never need to face the fear of eviction again. Next slide. In terms of community impact, you'll see that in the last year, we've celebrated 100% success in supporting households served to avoid eviction and homelessness. We have seen high rates of employment in a time where job insecurity was at its highest because of the pandemic. And because of our partnership with Connecticut Legal Services, we quickly linked our clients to legal representation while we maintained regular and responsive collaboration with Connecticut Legal Services for all households who were enrolled in our services. Now I'm going to turn over the panel discussion to Shirley, who is going to talk about her experience passionately working to prevent evictions and stabilize housing for some of our most vulnerable populations.
Thank you, Allison. My daily goal as a caseworker is to assist with alleviating the stressors in a family's household. I assist clients with connecting to resources for rental assistance, mental health services, and medical providers, working closely now with the elderly population, advocating on their behalf to ensure their needs are being met. I assist with completing applications for those who may have challenges with accessing technology. We work together to create goals they would like to achieve while in the program. When clients are referred to the program, my initial focus is building a relationship with them consisting of trust, honesty, open communication, and showing them this is a judgment-free zone. Currently, I'm working with a client who has multiple mental and medical health concerns, no support system, a limited number of resources, and an active eviction case. We've been able to now extend our program to assist with relocation services. While in the program, we were able to connect her with Southwestern Connecticut Agency on Aging. We've been attempting to complete the process of searching for an in-home healthcare aid. After a short time spent in a rehab facility due to a fall in her home while alone, the process has just faced many more challenges. Upon returning home, she lost 2 family members and she's just been emotionally unstable. She believed that she would be able to rebuild this relationship at some point in time, but due to everything, their medical concerns and hers, she wasn't able to do so. So we just want to make sure that we're checking in with our clients to make sure that they're expressing these emotions and they're speaking with not only their doctors, but their therapists. And for someone like her with no one else to speak with, we want to make sure that she's at least talking to us during the process. We're working on reaching out to 211 to see if there are any other resources, financial resources to help with moving costs, any resources to help with finding an affordable home. She currently holds a housing voucher, so we've been able to expand the search into the fair market rent just as well, all while still working with allied community resources to find an in-home aid. I've applied for housing in different cities. Because she currently holds a voucher, I've been able to speak with landlords just as well. I've spoken with landlords that I've worked with previously who may have vacancies in the apartments, or I reach out to coworkers if they have a landlord that they worked with in the past or even currently working with. I'm able to exchange that information and reach out and see if there are any vacancies that way also. This is someone who's been able to do everything on her own. So to go from that to now needing someone in the home just to help with basic needs, it's been a life-changing experience in itself. And we want to make sure that for any client that comes into the program, we're doing the same thing to make the process as easy as possible. On the other hand, I was able to successfully assist the client with avoiding eviction and keeping his apartment, all while battling against alcohol abuse. We took the first steps of independency by applying for Unite CT, which is a rental and utility assistance program in the Connecticut area. Immediately, as soon as we heard about it for rental and utility assistance, and because he does have difficulties with accessing a laptop, we worked together. So I would go on home visits. We would sit in the conference room and be able to do the application together. We also worked with his landlord on getting certain documents, as well as his attorney just as well. We worked on renewing his license, obtaining a new social security card, as well as a birth certificate. And then we worked with the homeless prevention program for financial assistance for his rental arrears just as well. His landlord was against the program. He did have some reserves. So we reached out to the landlord just to explain the program, the process of everything, as well as the benefits for not only the tenant, but the landlord for future tenants he may have that he may want to reach out to the program and be able to assist them that way just as well. So finally, he agreed to the program as well as Unite CT, and we were able to move forward with everything. Throughout the process, the client did have a slip of sobriety, but he felt that because of the relationship that we built, he was able to confide in me because he trusted me with knowing this information. So I was the first call he made as soon as everything happened. And we just talked about the process of everything and where his emotions were, what caused him to be there, and how could we go forward? Because my initial concern was, will this cause him to retreat during his whole process? Our check-ins moved to a weekly basis instead of bi-weekly, just to make sure that he was still engaging in his recovery programs and allowing himself to learn that this was only one mistake. It doesn't determine everything going forward. It was just a setback, and we can be able to move forward from this. During the program, we worked on budgeting, and he was able to save a substantial amount of money just in case Unite CT didn't work out. But for Unite CT, I was able to reach out to caseworkers, auditors, program managers. Every single person that works under the program has been able to speak with me about this one client in particular, just to make sure that his case didn't linger any longer than it already had. We understand everybody's going through it, but we wanted to make sure we focused on pushing the application as much as possible without overbearing the caseworkers at the same time. Finally, we were able to receive a successful payout on his behalf, and the landlord provided a new lease for the client to sign, which also caused him to retreat with his sobriety, because depression and anxiety, everything builds up on certain levels when you're going through the eviction process. The client was able to sign, and he's been happy ever since. He calls monthly just to check in and see how things are going. We sent them a birthday card out just to let him know that at the Stable Family Program, we understand things are going on, but we want to make sure that we're connecting and showing our clients that we do care. Both of these clients were referrals from Connecticut Legal Services. Madeline Anderson, who you'll hear from right after me, we've been able to work with all the attorneys in the office just to make sure that we're assisting the clients in every way. When entering the program, I work hard to show my clients I'm not here to pass judgment. I'm just here to restore their small bit of faith in humans. There are people that still want to help. There are people that are willing to help without looking down on them because of the situation that they're in. COVID has affected all of us in various ways, and we want to make sure that we help clients understand that we still understand that and we're going through it with them. That's what being a caseworker is about. That's what Stable Families Program does. For me, it's not about the recognition. It's about each client and their families being able to say, I provided them with the skill they needed to succeed after they've already entered into the program. So now I shall pass it over to Madeline Anderson, who will explain our partnership with Connecticut Legal Service.
Hi, thank you. I'm just waiting for my slideshow to come up. Thank you. So my name is Madeline Anderson. I am an attorney at Connecticut Legal Services, which is one of the 4 primary legal aid organizations statewide that provides legal services to low-income people in Connecticut. Next slide, please. We provide representation and advice to people in a variety of practice areas, not just housing, but also education, family violence, benefits, immigration, and so forth. And our clients come from a variety of sources, including statewide legal services, which operates the legal advice phone hotline in Connecticut, our community partners, such as Stable Families, and also walk-ins to our local offices. Next slide. In Connecticut, we're facing a crisis in the lack of affordable housing. This crisis has existed for a long time, and it's only growing worse now due to rising housing costs during the pandemic. Generally, rent is considered affordable for a tenant if they pay 30% of their household income towards the rent. And that's standard for tenants who receive some sort of housing subsidy. But most low-income, unsubsidized tenants pay a much higher proportion of their income to rent. And even though they may be able to afford it this month or next month, it means that anytime they face any sort of medical or personal emergency, their ability to pay rent can be jeopardized, and an eviction is likely to follow. Even when a tenant can afford to pay market rent, the units that are affordable to them are often substandard in terms of conditions, as well as the quality of the landlords that are willing to rent to them. And subsidized housing is not a solution for all of these extremely low-income households. The waiting lists for subsidized and public housing, depending on the city, can be years long. I have one client, for example, who is over number 1,000 on the wait list right now. That's why it's so important to help clients preserve their subsidies if they have it, because if a tenant loses their subsidy, it can really impact their financial future, and the chances that they'll ever get another subsidy are dim. Next slide, please. Here are some numbers to place the scope of the crisis into context. There's currently a deficit of more than 86,000 units of affordable and available rental units for extremely low-income tenants. So what that means is there are 86,000 more extremely low-income families than there are homes that they can afford in this state. In Bridgeport, where I work, the average renter has to work 93 hours a week at minimum wage in order to afford a market rate 2-bedroom apartment. And as you can imagine, this is far out of the reach of our average low-income client. Many of them cannot work this amount of time, do not have the experience or the work history to be able to do this, or suffer from disabilities or experience childcare costs that prevent them from affording these sorts of housing costs. Next slide, please. So this is where we step in to help. We represent tenants across most of the state in eviction court to try to help people keep their apartments and keep them housed. Even if we're not able to do that in every case, we can usually get them additional time in their current apartment so that they can use that time to find a new place to move to and hopefully reach a resolution with the current landlord that will minimally impact their ability to find new housing in the future. In addition to that work, we assist people on other issues, including subsidy terminations, the importance of which I talked about earlier, substandard living conditions, reasonable accommodation and emergency transfers when they're needed for people in public housing. And we also work with the various tenant councils in Bridgeport on redevelopment projects to ensure that there remains a supply of affordable subsidized housing in the city. Currently, we're working under contract with the Unite CT Rental Assistance Program to help tenants apply for that assistance and to represent tenants who are currently in eviction proceedings but may benefit from rental assistance. And in the coming months, we will also be representing clients under the new Right to Counsel in Eviction Cases programs, which was passed by the state legislature a few months ago, and which will start to be implemented in phases in the coming year. Next slide, please. In doing this work, our partnership with Stable Families has been invaluable. You've already heard about the work that Stable Families does through Allison and Shirley. For most of our clients, their housing problem is extremely important, but it's only one of the many challenges that they face. And Shirley's example of a client whose substance abuse problems was impacting his ability to keep housing is a really good example of the ways in which all of these problems and issues can come together to impact their lives. Our partnership with Stable Families allows us to work together to address the needs of our clients in a more holistic and comprehensive manner. Next slide, please. This is a list of the various resources that are available to people who are looking for assistance with housing and with relocation. And next slide, please. And finally, these are the contact addresses for our various offices. As I mentioned earlier, we do cover people across the entire state, with the exception of Greater Hartford and New Haven, which are covered by separate organizations. And with that, I will turn it over to our next speaker, and I'll be happy to answer any questions during our Q&A session at the end of the presentation. Thank you.
Thank you for sharing about the housing resources, explaining the affordable housing crisis, and getting a better understanding around the housing advocacy needs. Our next speaker is TJ Sioka, who is our New Reach grant writer. Oops.
Hi, my name is TJ, and this part of the program is about the financial benefit of eviction prevention. Funding for eviction prevention services is a wise investment because, one, the New Reach approach is consistently successful, as has been mentioned earlier, with 98% of families who completed the program over its 12-year history averting eviction. This approach has been further verified in a data match of 410 households over a 9-year period. None of these families entered the homelessness system. And there are short and long-term societal financial savings through prevention services. The increasing costs associated with eviction and homelessness, like emergency shelter, emergency health care services, criminal justice, or Department of Families involvement, are also short-circuited because of this, because of eviction prevention. Next slide, please. The financial benefit is clear. For example, 1,500 evictions are projected to happen in New Haven in 2022, which will result in short and long-term costs estimated to total over $20 million. For the same 1,500 households, it would cost $5.5 million to prevent evictions. That's almost a 400% rate of return. Next slide, please. Why else are investments in New Reach's prevention approach a wise choice? Because it's innovative, it's equitable, it's inclusive, and it makes homelessness rare. And because New Reach has 30+ years of experience in this field. There's also a huge need across the state, as Madeline mentioned. Requests for rental assistance and housing increased significantly this past year, and prevention services allows legal services and landlords, property managers, the time to focus on legal work and unit management. Social services is not in their scope of work. And finally, the pandemic has exacerbated uncertainty, isolation, stress, increased substance abuse, and mental health issues, as mentioned earlier. And these issues require a specific level of skill to address them appropriately, just as Shirley has mentioned. Next slide, please. So our typical funding requests include salaries for our well-trained and experienced caseworkers, professional development, and the other costs as listed here. What's key, though, is that New Reach's approach adjusts caseloads of its staff based on the complexity and the intensity of issues presented by clients. In other words, we may compute an average unit cost to serve one household, but our funding requests and needs drive to attain financial support to cover the full gamut of costs to employ full-time qualified caseworkers that are supported by a strong and established agency infrastructure with solid financial, compliance, and supervisory systems. Next slide. So what are our next steps? We know that we're only touching the iceberg's edge in Bridgeport and would like to significantly increase our services there. And we hope to expand this approach in New Haven with new partners on board, including the New Haven Legal Assistance Association and the Housing Authority of New Haven, Elm City Communities. Thank you. And now we'd like to turn it back over to Allison for questions and answers.
Thank you, TJ. So if anyone has any questions for any of our panelists, please feel free to add those into the chat.
I think that we've done, oh, here comes some questions. I was going to say the panelists did such a great job that you've left the audience speechless. Allison, it looks like there's a few questions there for you.
For Shirley, who has been your most impactful client?
My most impactful client would be the second client that I spoke on, only because when he came, we worked so close together. I mean, he went from calling every day in a panic to being able to just call and say, you know, oh, I'm doing this on this weekend, or this is what I'm doing this weekend. You know, it's just been a reflection of the work for me. I'm not a person that likes to acknowledge too much of what I've done. So, you know, small things like him just being able to stay in his apartment and be so proud about it has just been the biggest impact for me with doing the work.
Thank you, Shirley. And for Madeline, what are some challenges clients must overcome from a legal perspective when faced with eviction?
That's a very broad question. There are a lot of challenges that people must face. But I think one of the biggest challenges right now is that there is this source of funding, Unite CT, out there to help clients who are in the middle of non-payment evictions. But oftentimes the timelines on the Unite CT application process just don't match up with the timelines on summary process eviction cases. Summary process eviction cases follow an accelerated timeline where pleadings are due every 3 days and cases are often scheduled for trial within a month. And there are certain steps in place right now, such as a mandatory 30-day stay to pause proceedings. But even when that happens, very often Unite CT doesn't come through in time to help all of our clients. And so we work really hard to push them forward and push those applications forward, because if a landlord's willing to take the money and willing to withdraw the eviction against the client, then we really want them to be able to do that. Thanks.
Thank you. And I see here a question from Sophie. How does a housing voucher work? So right now, housing vouchers they're throughout the nation. There are long wait lists for many of the housing vouchers that are out there. But when someone is matched to or accepted for a housing voucher, it is income based. So the amount of rent covered by the voucher supplements the income of the household so that it becomes an affordable rate. Every voucher is different. Some function at 30% of income, some function at 40% of income, but essentially so that it reduces that rent burden cost for households so that they can maintain that. Housing vouchers also have maximum amounts that they can cover, so it has to be within what's called the fair market rent. Which has been actually difficult during this time because of during this pandemic, the cost of housing has also increased in the Fairfield County area, especially where rents are going at higher rates than what a voucher can cover, which then can start to limit where someone might be able to apply that voucher. So that's kind of the short of how those vouchers work. Some are very specific to where a person may live. Others can travel to different housing opportunities with that person. So it really varies on the type of subsidy or voucher that someone might have. I also see here a question for TJ. How much funding is needed to prevent an eviction?
I think that the cost per unit obviously is going to change. That the average length of service that our program provides services is about 8 months. So it's, it's intense services. So it can range anywhere from, $3,500 per household to $5,000 per household.
I see here a question from Trisha Lewis. Thank you so much for the presentation. Can you speak more on housing relocation services? What happens to those who want to leave public housing or their current housing situation due to disrepair or violence in the area? I think each of us can speak to this to some degree, because it is a very, very difficult, complex situation when someone has habitability issues or
Hello.
active
How's it going?
domestic violence or community violence.
Hold on, let me just turn this.
And it, when leaving public, when the decision is made to leave public housing altogether, you're going from an income-based rent market to the fair market, because you're in public housing, you cannot take that affordable voucher or subsidy with you. It stays with the public housing. Some things that we assist with involve advocacy around emergency transfers under the Violence Against Women Act, or VAWA, which applies to men and women. It's not specific to women undergoing domestic violence. And we help to communicate with those who are managing the subsidy with Connecticut Legal Services to expedite those requests, obtain all the documentation necessary, and proceed in whatever direction is needed so that we could support a household with what choices they may have. Similarly, with any kinds of disrepair and trying to negotiate and communicate with the landlords, whether this be in a subsidized or an unsubsidized unit, to be able to help increase the habitability. I don't know if Madeline or Shirley has more that they would like to answer on that question.
I just want to add that we make sure we have these realistic conversations with each client as well as the adults in the household, because a lot of them have children who may be over 18. So we want to make sure we include them in the process just as well. We want to make sure that we're explaining to them, the pros and cons of moving out of housing, the process of how long it takes. We make sure we tell them, it's not an easy process to go from housing and then to fair market rent. And then, with COVID and everything going on, if someone loses a job, there's nothing else that they can fall on to help with covering a certain basis. They can't go and report their income change and then their rent be moved down to a lower amount. So we want to make sure we're having those realistic conversations so that we're not just encouraging them to go out and then fall on their face. We want to make sure we support them in their decision while also knowing what takes place after.
Thank you. And for Madeline, how does someone going through the eviction reach out for legal assistance?
So if someone is already connected to one of our community partners like Stable Families, we'll take a referral directly from that partner. And that minimizes the amount of hoops that a client has to jump through in order to get to us. For clients who are not already connected to anyone, the best thing for them to do is to contact the statewide legal aid hotline, statewide legal services. And then that way they can get immediate advice over the phone. They don't need to wait for us to do an intake. And statewide legal services will then refer them, if they're eligible, to the nearest legal aid office in their area.
Thank you, Madeline. I just want to draw attention to Connie's comment in the chat as well. And she said, thank you for the explanation of affordable housing, the definition of extremely low income, but also defining this as low and very low. Low meaning 30%, or very low meaning 30%, low is 50% of that area median income. There are low income tax credit, LITC is what that's abbreviated as, that are available to developers of housing to create more affordable housing in each community. So more education around this could help reduce that fear or that stigma of expanding the supply of affordable housing that is so needed in our communities. I also have a question here from Sophie for TJ. If it's more cost effective to prevent evictions than to evict people, why do you think our cities have not addressed eviction in a better way yet?
I'd probably like to pass this on to Kellyanne, this answer, but I mean, I would say because it's evolving and because New Reach is an innovative and progressive organization that's taken it on and has now shown years of success, but I'd like Kellyanne to finish that off.
Sure. You know, in my opinion, Sophie, I think that we in the state of Connecticut focus more on the immediate crisis that's in front of us. And we often don't focus enough upstream on preventing crisis from occurring. And so this is truly a prevention for homelessness program. We go upstream and we look at folks who would likely end up in the shelter system if they lost their housing. And I think that very often, you know, we're more reactionary in the state. We react to what's right in front of us and the crisis right in front of us. And sometimes we don't even do that very well. But this is a program that takes longer to show the positive outcomes. And so I will say that we are making strides, and the Eviction Prevention Partnership concept, which is based off of Stable Families, will be on the Reaching Homes advocacy agenda for the legislature for next session and probably for future sessions. So we are looking to bring that to the attention of the public funders so they can see that return on investment. In addition, as I mentioned earlier in the opening, this program is 100% funded by our private partners, which has just been a really amazing partnership that our private family foundations and corporate foundations have invested in this and understand the need to go upstream and prevent folks from actually entering the homeless system.
Thank you, Kellyanne. And we probably have time for maybe one or two more questions if there are any others from our audience today.
So hearing none, I would just like in closing to say a thank you to Allison, Shirley, Madeline, and TJ for sharing the Stable Families Eviction Prevention Partnership with you today. I hope we increased awareness on the need for the eviction prevention through our Pathways to Home virtual series. As you heard, the need for eviction prevention services is going to increase when the eviction moratorium is lifted in February of 2022. So New Reach is working to expand the program in Bridgeport and to implement the program in New Haven. Thank you everyone for attending today, and please reach out to us if you have any questions or you want to get involved. Thank you and have a great day.